Every single day, people sit across from their doctor and hear the same thing. Cut back on the coffee. Your blood pressure is too high. Too much caffeine is hard on the heart. And they listen. They switch to decaf, or they quit entirely, and they assume they are doing the right thing. Here is what nobody tells them. The research published over the last 10 years, large-scale studies, hundreds of thousands of participants, tells a completely different story. Moderate coffee drinkers consistently show lower rates of heart attack, lower rates of stroke, and lower rates of cardiovascular death than people who drink no coffee at all. Not the same rates. Lower. So either the science is wrong or the advice is outdated. I will save you the suspense. It is the advice. The problem was never coffee. The problem is how most people over 50 drink it. The timing, the things they add to it, the quantity, the combination with blood pressure medications. Get those wrong, and yes, coffee becomes a cardiovascular stressor. It raises your pressure, overworks your heart, and disrupts your sleep. But get them right, and coffee becomes one of the most accessible, affordable protective tools you have for your heart, your vessels, and your brain. That is what this video is about. Not whether you should drink coffee, but exactly how to drink it so it works for your heart instead of against it. Subscribe and hit like right now. What you are about to hear, nobody is going to lay out for you at your next checkup. The system does not make money when you learn to protect yourself with something that costs $1 a day. Help Dr. Johnson reach 100,000 subscribers. Every single one counts. So let us start with the science. What actually happens inside your blood vessels when you drink a cup of coffee? Coffee contains over 1,000 bioactive compounds. Most of them are irrelevant to this conversation. The two that matter for your cardiovascular system are caffeine and chlorogenic acids. Caffeine is a stimulant. Most people know that much. What they do not know is where it stimulates and what it blocks. Caffeine works by attaching to receptors meant for a molecule called adenosine. Adenosine is a chemical your body uses to signal relaxation and widening of blood vessels. When caffeine sits in those receptors instead, the signal never arrives. Blood vessels temporarily constrict, they narrow, and that is why blood pressure can spike 20 to 30 minutes after your first cup. That spike is real, it is measurable, and for decades that spike is the only thing doctors looked at. But chlorogenic acids, the other major compound in coffee, do something entirely different. They promote the production of nitric oxide, a gas your blood vessel walls produce to stay flexible and open. Nitric oxide is one of the most important molecules in cardiovascular health. It keeps arteries relaxed, prevents platelets from clumping together, and slows the formation of plaque on vessel walls. So coffee delivers two competing signals at the same time. One that briefly tightens your vessels, and one that, over time, protects and relaxes them. The net result depends entirely on how you drink it. That is the mechanism. Now let me show you what most people get catastrophically wrong. And by the way, a lot of you have already been checking out Care Health. That is the link on my channel page. It has been getting a huge response lately. More on that toward the end. But for now, let us get into the first mistake. The first mistake is the one almost everybody makes and nobody questions. You wake up, you walk to the kitchen, and the coffee is brewing before your eyes are fully open. Here is what is happening inside your body at that exact moment. When you open your eyes in the morning, your adrenal glands release cortisol, your body's primary stress hormone. Cortisol does not peak immediately. It climbs over 30 to 45 minutes and hits its highest point roughly half an hour after waking. This is called the cortisol awakening response, and it is a completely normal, healthy process. It raises your blood pressure, increases your blood sugar, and sharpens your alertness to get you out of bed and moving. Now imagine pouring caffeine directly on top of that cortisol peak. You are stacking two blood pressure-raising mechanisms at the exact same time. The result is a sharp, exaggerated spike in blood pressure that can push your systolic reading, that is the top number, 15 to 25 points above what either stimulus would produce on its own. After 50, when your vessel walls are already less elastic and less forgiving, that morning double spike hits harder than it would at 30. Over months and years of daily repetition, that compounding stress contributes to arterial stiffness and left ventricular strain. That means your heart has to pump harder against tighter vessels every single morning, not because of disease, because of timing. The fix costs you nothing and requires zero extra effort. Wait 60 to 90 minutes after waking before your first cup. Let cortisol do its job and begin declining on its own. Then introduce caffeine. Your blood pressure rise will be gentler, more gradual, and significantly less stressful on your cardiovascular system. Drink a glass of water first. Hydrate before you caffeinate. That single timing shift changes the hemodynamic load on your heart every morning for the rest of your life. Now the second mistake. And this one is destroying coffee's benefit from the inside out. Black coffee, plain, contains essentially 0 calories. It delivers all of the protective chlorogenic acids and antioxidants we just discussed completely intact. The moment you add sugar, flavored creamers, whipped toppings, or artificial sweeteners, you fundamentally alter the metabolic equation. Start with sugar. A single tablespoon of sugar in your coffee triggers an insulin spike. Insulin does more than manage blood sugar. It promotes sodium retention in the kidneys, which increases blood volume and raises blood pressure. It also drives inflammation in the endothelium, the inner lining of your blood vessels, the exact lining that chlorogenic acids are trying to protect. Think about what you are doing. You are drinking a beverage that contains compounds specifically designed to shield your vessel walls while simultaneously dumping in a substance that damages those same walls. The protective effect does not just decrease, it gets canceled. In some cases, it reverses entirely. Now the creamers. Most commercial flavored creamers contain hydrogenated vegetable oils. Those are trans fats. Trans fats are the single most destructive dietary substance for your cardiovascular system. They raise LDL cholesterol, the kind that builds plaque. They lower HDL cholesterol, the kind that clears it. And they directly inflame arterial walls. A tablespoon of flavored creamer, twice a day, every day, for years. That is not a harmless habit. That is a slow-moving cardiovascular insult hidden inside something that feels comforting. The rule is simple. Drink your coffee as close to black as you can tolerate. If you need to soften it, a small amount of whole milk or a splash of unsweetened oat milk. No sugar, no artificial sweetener, no flavored creamer. The coffee itself is the medicine. Everything you add to it is working against it. The third mistake is about quantity and timing, and most people get both wrong at the same time. The research here is remarkably consistent. The cardiovascular protective effect of coffee peaks at 3 to 4 cups per day, where 1 cup is roughly 8 ounces, about 240 milliliters. Below that, the benefit is present but modest. Above that, 5, 6, 7 cups, the benefit plateaus and the risks begin to climb. Here is why. Excess caffeine overstimulates the sympathetic nervous system, that is the fight or flight branch, the part of your nervous system designed for emergencies, not for Tuesday afternoon. Chronically elevated sympathetic tone raises your resting heart rate, pushes your baseline blood pressure higher, and makes the heart more susceptible to arrhythmias, which are irregular heartbeats. After 50, when the electrical conduction system of the heart is already less stable and less forgiving, that overstimulation matters more than most people realize. Now, timing. Caffeine has a half-life of approximately 5 to 6 hours. That means half of the caffeine from a cup at 3 o'clock in the afternoon is still circulating in your blood at 8 o'clock or 9 o'clock at night. You may not feel wired, you may fall asleep without difficulty, but caffeine in your system at bedtime disrupts deep sleep, the phase your cardiovascular system depends on. During deep sleep, blood pressure naturally drops by 10 to 20%. This process is called nocturnal dipping, and it is your heart's recovery window. If caffeine prevents you from reaching that phase, the dip does not happen. Your heart works all night at daytime pressure levels. Over years, the loss of nocturnal dipping is one of the strongest predictors of heart attack and stroke. The rule: no coffee after 2 o'clock in the afternoon if you go to bed around 10 o'clock. Adjust the cutoff to your own schedule, but protect your sleep as fiercely as you protect your morning cup. The fourth mistake sounds harmless and feels completely normal. Coffee on an empty stomach. Most people do it without a second thought. Here is the problem. Coffee stimulates the production of hydrochloric acid in your stomach. When there is food present, that acid has something to work on. When the stomach is empty, that acid has nowhere to go but into the lining itself. It irritates the stomach wall, triggers excess acid production, and can set off acid reflux, what doctors call gastroesophageal reflux disease, or GERD. But the gastric discomfort is not the real issue. The cardiovascular connection is less obvious and far more important. Caffeine absorbed on an empty stomach enters your bloodstream significantly faster than caffeine absorbed alongside food. The blood concentration spikes higher, peaks sooner, and crashes more abruptly. That rapid spike and crash pattern is substantially more stressful on your cardiovascular system than a gradual sustained rise. It creates a sharper blood pressure pulse and triggers a more aggressive adrenal response. Your heart and your vessels experience a jolt instead of a gentle lift. Think of the difference between stepping off a curb and jumping off a wall. Both get you to the ground, one of them hurts. The fix requires almost no effort, a small meal before your coffee. Even a handful of nuts, a piece of toast, a few spoonfuls of oatmeal. That small amount of food in your stomach slows gastric emptying, moderates the rate of caffeine absorption, and flattens that sharp spike into a gentler, sustained curve. Your heart gets a manageable, gradual increase in stimulation instead of a sudden demand it has to scramble to accommodate. Eat something first, then coffee, every single day. This is not optional after 50. This is how you keep the benefit without the cost. The fifth mistake carries the most immediate clinical danger, and it is the one almost nobody discusses. Not online, not in a waiting room, and often not even during the appointment where the medication was prescribed. Millions of people over 50 take antihypertensive medication, drugs specifically designed to lower blood pressure. Common classes include ACE inhibitors, calcium channel blockers, and beta blockers. If you are on any of these, what I am about to say applies directly to you. Caffeine interacts with these medications in ways that are clinically significant. With certain calcium channel blockers, caffeine interferes with the liver enzyme responsible for breaking down the drug. When that enzyme is blocked, the drug is not cleared from your body at the expected rate. Its concentration in your blood rises higher than your doctor intended. The result is that your blood pressure can drop too far, too fast. That leads to dizziness, lightheadedness, fainting, and falls. After 50, a fall from fainting is not a minor event. It is a fractured wrist, a broken hip, or a head injury. With beta blockers, the interaction runs in the opposite direction. Caffeine can partially counteract the drug's intended effect on heart rate. Your medication is trying to slow the heart down and ease its workload. Caffeine is pushing it back up. The drug does not work as effectively as your cardiologist expects, and neither of you may realize why. Here is the critical point. Nobody is saying you must stop coffee because you take blood pressure medication, but you must separate the timing. Take your medication first. Wait at least 1 to 2 hours before your first cup of coffee, and you must tell your prescribing doctor exactly how much coffee you drink daily. Not roughly. Exactly. Cups, size, frequency. Because dosing adjustments may be necessary, and your doctor cannot make those adjustments with information they do not have. This is not about fear. This is about precision. Now, after 5 mistakes, you might be wondering whether coffee is even worth the trouble, whether the risk is simply too high after 50, and the safest move is to quit altogether. The research says the opposite. Studies involving hundreds of thousands of participants across multiple countries, tracked over years, consistently show the same pattern. People who drink 3 to 4 cups of coffee per day have approximately 15 to 20% lower risk of cardiovascular death compared to people who drink no coffee at all. Not the same risk. Measurably, significantly lower. The protective mechanism is not one single pathway, it is several working together. Chlorogenic acids reduce oxidative stress, the cellular damage caused by unstable molecules called free radicals that attack your vessel walls. They lower chronic low-grade inflammation, which is the underlying driver behind plaque formation in your arteries. And long-term moderate caffeine consumption appears to improve endothelial function, meaning the ability of your blood vessel lining to relax and contract the way it is supposed to. There is also emerging evidence that regular coffee drinkers have lower rates of type 2 diabetes, which is one of the strongest independent risk factors for heart attack. The mechanism appears to involve improved insulin sensitivity. Your body's cells respond more efficiently to insulin and manage blood sugar better, but here is the part that matters most. Those benefits were observed in people who drank coffee correctly, black or near black, moderate quantity, appropriate timing, not combined recklessly with blood pressure medications, not loaded with sugar and flavored creamer. The coffee in those studies is not a caramel frappuccino with whipped cream and syrup. It is simple, unadorned coffee drunk by people with consistent habits. The science is not telling you to quit, it is telling you to pay attention to how you drink it. Now I want to address the contradiction that confuses almost everyone, including many physicians. Yes, coffee causes an acute, temporary rise in blood pressure. Roughly 5 to 15 millimeter HDIs lasting 1 to 3 hours after consumption. That is real. That is measurable. Nobody is disputing it. But here's what most people never learn. Regular coffee drinkers develop a tolerance to that spike. After about 1 to 2 weeks of consistent daily consumption, the acute blood pressure rise diminishes significantly. The body adjusts. Your cardiovascular system recalibrates to accommodate a predictable, familiar stimulus, and the spike becomes smaller, shorter, and less relevant. More importantly, while that acute effect is fading into the background, the long-term effects of chlorogenic acids are quietly building. Nitric oxide production increases, arterial stiffness decreases, systemic inflammation, the slow-burning fire behind nearly every cardiovascular disease gradually lowers. Over time, those protective effects dominate. That is exactly why large cross-sectional studies consistently find that habitual coffee drinkers have similar or even slightly lower resting blood pressure than non-drinkers. Despite the spike, despite the caffeine, the long-term chemistry wins. The key word is habitual. Consistency is everything. If you drink coffee erratically, 2 cups Monday, nothing for 3 days, then 4 cups on Friday, your body never fully adapts. You get the acute spike every time without ever building the long-term protective offset. You are paying the cost without collecting the benefit. The message is straightforward. Pick a moderate, consistent daily amount and stick with it. Same number of cups, roughly the same times, every day. That consistency is the mechanism through which coffee shifts from a blood pressure stressor to a blood pressure neutral or even protective habit. Your body does not adapt to chaos. It adapts to routine. Now let me pull everything together into a clear protocol you can start using tomorrow morning. After 50, the margin for error is smaller, your vessel walls are stiffer, your heart's reserve capacity is lower, your kidneys filter slightly more slowly, which means caffeine clears your body at a reduced rate. Medication interactions are more common. All of this means the way you drink coffee matters more with age, not less. Here is the protocol. It is simple, it costs nothing, and it accounts for every mechanism we have discussed. When you wake up, drink a glass of water, not coffee, water. Your body has been dehydrating for 7 or 8 hours. Rehydrate first. Wait 60 to 90 minutes. Let your cortisol peak pass on its own. Then eat something. It does not need to be a full breakfast. A handful of nuts, a piece of fruit, a slice of toast, something in your stomach to slow caffeine absorption. Now have your first cup, black, or with a small splash of whole milk or unsweetened oat milk. No sugar, no flavored creamer. Stay at 3 to 4 cups maximum, spread across the morning and early afternoon. Your final cup should be no later than 2 o'clock in the afternoon. After that, the tap is off. Protect your deep sleep and your nocturnal blood pressure dip. If you take blood pressure medication, separate it from coffee by at least 1 to 2 hours, and tell your doctor your exact daily caffeine intake. Not approximately, exactly. If at any point you notice heart palpitations, persistent anxiety, or disrupted sleep, reduce by 1 cup and hold that new level for 2 weeks before reassessing. One final step. Track your blood pressure at home, once in the morning before coffee and once in the evening. Write the numbers down. That gives you and your doctor real data instead of guesswork. Real data changes real outcomes. You might be wondering why your doctor never told you any of this. Why nobody sat you down and explained cortisol timing, or chlorogenic acids, or the interaction between caffeine and your calcium channel blocker? The answer is not that your doctor does not know. Most of them do. The answer is that the system they work inside does not give them the space to tell you. A standard office visit lasts 12 minutes. In those 12 minutes, your doctor has to review your chart, check your vitals, address whatever complaint brought you in, adjust medications if needed, and document everything for billing. There is no time left for a nuanced conversation about coffee pharmacology, cortisol cycles, and how your evening habits affect your nocturnal blood pressure dip. It is faster and safer to say cut back on the caffeine and move to the next patient. There is no billing code for lifestyle optimization. There is no reimbursement line for teaching someone how to drink coffee correctly. No pharmaceutical company is funding research into the optimal timing of your morning cup because there is no product attached to the answer. No one profits when you protect your heart with a habit that costs $1 a day. The incentive structure in modern healthcare does not reward prevention, it rewards intervention. Procedures, prescriptions, follow-up visits, diagnostic imaging, that is not a conspiracy, that is economics, and the people who suffer the consequences are the patients sitting in those waiting rooms who never get the full picture. That is exactly why this channel exists. To fill the gap between what the science actually says and what gets communicated in a rushed appointment. Your health is your responsibility, not because doctors do not care, but because the system they operate in does not give them the time or the incentive to teach you what you genuinely need to know. Now, here is an honest reality. Everything I have explained today, the timing, the protocol, the medication interactions, these are things you can start doing tonight. They cost nothing, they require no prescription, and for many of you, they will make a real measurable difference. But some of you watching this are dealing with something bigger. Your blood pressure has not responded well to medication. You have been living with cardiovascular risk factors for years, and the standard path of prescribe, recheck, adjust has not given you the results you need. You are looking for something beyond the usual cycle. That is where I want to tell you about something thousands of viewers on this channel have already taken advantage of. It is called Care Health, and it connects you directly with clinical trials for cardiovascular conditions, blood pressure management, and heart health. Real monitored medical studies run by research teams across the United States, many of them offering access to treatments that are not yet available to the general public, enhanced monitoring, personalized care, potential cost savings, and the chance to contribute to medical progress that benefits everyone who comes after you. This is exclusively available to U.S. residents. If you are watching from the States, you can enter by clicking the link on my channel page or by scanning the QR code appearing on your screen right now. Open your phone camera, point it at the square, and tap the link that appears. If you are watching on your phone, tap my channel profile picture at the top of this video. That takes you to my channel page where the link is waiting. A screenshot is on screen right now showing you exactly where to find it. I will be straight with you. Spots in these trials are not unlimited. Thousands of viewers have already signed up, and the response has been overwhelming. Trials have enrollment caps, and once they fill, they close. If anything in this video hit close to home, your blood pressure, your medication, your risk factors, do not put this off. This window will not stay open forever. Your coffee is not your enemy. Your age is not your enemy. Inaction is. Click the link. Let Care Health match you with a trial that fits your situation. It takes 30 seconds, it costs you nothing, and it could genuinely change the trajectory of your health.